Hi everyone, and welcome to the Dental Podcast from dempan. I'm today's host, Tom. In this episode, I'm pleased to introduce an interview that we had at the end of 2020 with Doctors Simon and Meghan Chard. Simon and Meghan are hugely recognisable figures within the industry, and I'm sure you'll agree that this is a fascinating and insightful look into modern dental practice. Please note, all safeguarding and social distancing guidelines were adhered to at the time of recording.
Hi, I'm Lewis Mackenzie. I'm the Head Dental Officer at dempan, and today I'm with Simon and Meghan Chard at their lovely practice Rothy Lodge near the Thames in Staines.
Hi, I'm Dr. Meghan Chard.
And I'm Dr. Simon Chard, and we're here today with dempan, who have become a really great team member here at Rothy Lodge Dental Practice.
Thank you, Simon and Meghan, for chatting to dempan today. Yours is a long-established family practice. Can you tell us a little bit about the history?
Yeah, sure. So my parents, who are both dentists, they bought the practice, I think it was 6 months before I was born. So I'm now, how old am I now? 34. So 34 years ago. And at that point, it was just a one surgery, sort of one-man band practice. Over the last 32 years, they grew it up to a 5 surgery, sort of very family-focused practice. Where they built a fantastic reputation with the local community. Meghan and I qualified in 2012 and then started working here from 2013, I guess it was. And we worked here as associates. And then back in 2017, start of 2018, we bought the practice from my parents. We actually added 2 extra surgeries on top, as well as a training centre and a facial aesthetics sort of sedation recovery room, and brought in a lot of technology. So all of the sewing machines, 3D printers, and the airflow machines, and brought in some dentists with advanced skills in perio and endo and those sort of things. So what we tried to do was take the fantastic business and reputation that they brought, that they'd created locally, and then add in multidisciplinary team, technology, and then also, I guess, a social media drive for bringing in new patients, which has been very successful.
What advantages have you both found about being able to offer patients treatment on a private basis?
Yeah, so I mean, both of us, when we qualified, we went out into mixed practice, working within the NHS and doing a little bit of private. We've both done extensive training postgraduately in restorative, aesthetic, myself more down the sort of implant surgery route, Meghan with sedation. And as we move forward with that advanced education, we wanted obviously to be able to provide those skills for our patients. And so as we moved through the early stages of our career, we found ourselves gradually moving more towards the private sector, so that we could provide those more advanced treatments that require more time, naturally are more expensive, but in our opinion allow us to provide the highest level of care for our patients.
Yeah, and I mean, it allowed me really to focus on sedation. So I've done a postgrad diploma in sedation, and I love treating nervous patients and, you know, getting them to go through dentistry where they're very, very anxious. So to be able to spend the time to do that and offer that treatment for patients has been, you know, just been really great and made me really enjoy dentistry and give me a real passion for dentistry to be able to do that.
So the extra time for you is the critical factor?
Yeah, the time factor is it was so important for me. I just felt beforehand I was so rushed off my feet. I couldn't give the time to the patients that I wanted to give them. I had to kind of keep I was running late all the time. You know, that makes patients angry as well. You get stressed running late. So for me, being able to slow things down a little bit and sit there with the patients who you do really care about, and you want to give them the best advice, and you want to, you know, explain things properly to them. And so being able to do that with the time that private dentistry gives you is really enjoyable, and it really instills a passion again in you for dentistry.
On that same subject, Simon, you're an ambassador for slow dentistry. Could you tell us a bit about that?
Yeah, absolutely. I think the slow dentistry ethos fits very much into what Meghan was saying, in that being able to take the time to provide the care that we're after allows the dentist to be a lot less stressed. And we all know that stress and burnout and mental health is a massive issue in dentistry. And by practicing in a slow dentistry manner, and what I mean by that is having the time to over communicate and explain all of the risks to your patients and make sure they understand things, that takes a really long time, and it's very difficult to do that in a 15-minute appointment, for example. But taking the time to do that makes a big difference to your own stress levels, because you feel the patient really understands what they're in for. Taking the time for anesthesia, taking the time, obviously super important at the moment for cleaning down the surgeries and that sort of thing. It just allows you to have a bit more headspace and a bit more of a calm working environment, I think. Certainly that's how I found it as I transitioned through. When you can book in the what you view to be the appropriate amount of time for those complicated procedures.
And not only that, litigation is massive in dentistry. So when you're rushed and you're trying to do as many things at one time, you are going to make mistakes or errors or miss something. So being able to actually take the time to review things, do things really thoroughly, then you know that you're being safe and you've got the time to write the notes. And so it's just from a worry point of view as well, of ever being sued, it really helps just to slow things down.
You both offer your patients Denplan payment plans. What do you see as the advantages of these for your patients, but also to you as practice owners?
Well, I think with patients, first of all, it helps to spread the costs for them. So, they spread their monthly costs out. Whenever they come for their exams and the hygienists, they've already paid for it. So, they don't have to worry about some of the upcoming fees. It's all spread out in a nice bite-sized chunk that they can afford. So that's, I think, one of the main benefits for patients. Also, they're already paying for it, so they're therefore more likely to come to their exams and their checkups and their hygiene appointments, which means we can regularly check for any pathology. Their gums are, and their oral health is going to be optimum if they're coming twice a year. And because they're paying for it, they're going to make sure they're attending for it. So again, that's great for patients. Not only that, things, like oral cancer checking and things like that, we can, we're really, with the regular attendance, we'll really get to, we really can compare and evaluate the patient's tissues and things like that. And I think, in general, the patients, it's a much better service for them. And I think finally as well for the patients, being part of a payment plan, they really do feel part of the family of the dental practice. They really do feel like they belong here and that, this is where they come to get looked after by us.
Yeah, and I think from a business point of view, having that reliable source of income that is going to be coming in every month, especially at the moment in these difficult times, has been really, really positive for us as a practice. When patients are paying for their checkups and their hygienes already, we've seen a massive drop off in the number of FTAs that we're seeing. And I just think as a private practice, it just makes sense from a business model point of view, especially if you ever plan to sell your practice in the future. You can actually show the incoming potential buyer, this is genuinely how much income we have coming in every month. So from a financial planning and a business planning point of view, I think it makes a lot of sense. And
the patients are committed to the practice as well, aren't they? It's you can see how many patients the practice actually has and their regular attendance, and they come and they're committed to being members of Rothy Lodge. Yeah,
exactly. I think it's a synergistic benefit for both the dentist and the patients that at the end of the day leads to better oral health for our patients, because we are incentivizing that good behaviour.
Which is the prime goal, really, isn't it?
Absolutely.
So how was the Denplan transition process for you both?
It was actually so easy. It was much easier than I anticipated. It was very smooth. The support we had in the preparation was incredible. We had help in writing our letters. We had help in what we should say, to our patients, how we should explain things, how we should do things. We had Atia coming in to go through how to answer phone calls and discuss queries with patients about Denplan over the phone. And when we actually went live, Atia actually came in to be behind reception to support the girls and help them with any questions or any things that they didn't know about, or any anything they got stuck on, really. So actually it was so easy. I was really worried at first because it was a big jump going from NHS and different plans and things like that we had in the practice, but they've made it so smooth and easy and an enjoyable process.
How did you find the process, Simon?
Yeah, very, very similar from my end, to be honest. I think any change is always scary as a business owner, and especially as relatively young business owners, in that we've only been running the business for 3 years now. It's always worrying, changing how things have run for many, many years. And Atia and the team at Denplan made the whole process really, really straightforward. As Meg says, loads of support. Atia was always at the end of the phone, but oftentimes was actually here in the practice. And we found the whole thing really great. And the outcome now is that we feel that the practice as a whole is really nicely structured. Everything's running smoothly, and Denplan have been a big part of that for us. So
how is Denplan supporting your practice growth and development?
So Denplan have been and continue to be incredibly supportive. If we go back a couple of months just before lockdown, when we were all allowed to sit in one room and train together, Denplan actually had people come in to give us staff training on communication and like complaints and confidentiality and things like that. We've also had Atia come in to offer treatment coordination advice for our new TCO that we've got, which has been invaluable, and she's recommended lots of books that we've bought for the practice for our TCO. And again, that was a new role that we've brought into the practice, and Denplan, just very kindly have offered to help us with that and support us with that. So, that's been great. During lockdown, they put on these incredible webinars, which were attended by many in the thousands. And all our staff signed in on that for infection control and updates on COVID. And throughout the whole pandemic, they've kept us updated, kept us informed, and supported us throughout. Patients who have been struggling to pay for their Denplan during COVID because of, their job situations, they've offered advice on how we can pause payments or how we can support patients. So that's been really helpful as well. And not only that, they've been so generous with the grants that they've given us for buying PPE, which at the time, the PPE costs were rising an enormous amount. Something that would cost a certain amount would then have gone up by 400%, when we were coming back to the practice to work.
Yeah.
And that was an incredible amount of stress on us, worrying about how much PPE we'd need to pay for. And Denplan gave us an allowance, a very generous allowance, to help towards the cost of that. So we just feel that Denplan have been so supportive and really almost like a comfort blanket there the whole way through this pandemic. So we're eternally grateful for that.
Yeah, it's those little touches that on top of what you would expect that have made the big difference. And I think why we feel so comfortable discussing the relationship we have with Denplan is because of the support that they've given us as young practice owners in probably the hardest year of our careers so far. It's really great to see such a big company be so hands-on in that way.
I really feel like this go over and beyond what we even expected of them, really.
Yeah.
So that's been really nice.
Simon, you moved your patients from another plan provider. Why did you choose Denplan to look after your patients going forwards?
Quite a few reasons, to be honest. One of the main ones was Denplan, for me, is the name in the sector. And I think Denplan has a reputation with patients as well, which makes it very easy when you're communicating with them to say, oh, we have Denplan, and that links in very nicely. But the main thing for us really was just the support that Denplan were offering to help us with. You don't learn dental business at dental school. There's no real business training whatsoever. And the business support that they were offering to help us with regards to education and team training and lots of things that we wanted to implement at the practice was really one of the key drivers for me to move to Denplan. On top of that, we already had a mixture of different plans in the practice, and it was nice to bring it all under the one umbrella of Denplan. It makes it a lot easier for our team, and to be honest, the team management element of it is probably the most important bit. If your team are on board with this sort of thing, it makes the whole process a lot easier. If the team aren't well supported, then it makes it a much larger hill to climb to get the patients and the practice on board.
Dentists moving patients from other plan providers to Denplan sometimes worry that they might lose some patients. What was your experience?
Any change is always a worry for a principal. And certainly I had those concerns myself. But to be honest with you, the transition was seamless. The support was great. We didn't lose any patients in the move. And Atia was very, very helpful with regards to correctly pricing the plans and all of those things, which made the whole thing very, very straightforward and very easy. So it was really painless.
How has being a Denplan dentist benefited your life-work balance?
Before being with Denplan, I just really felt worn out at the end of the day. So tired. You know, I did love dentistry, but I'd have just some good days and some bad days, and just wasn't loving it. But since I've joined Denplan, I can honestly say that it's reignited my passion for dentistry. I love every day coming in. It's a real pleasure to be seeing patients. I come home, I'm not exhausted. I've seen, I've seen a normal amount of patients in the day that I feel that I can have the energy for. So that's the first thing. It just in terms of my energy levels, it's really helped with that. And another sort of benefit from Denplan is when you do go away on holiday, we are self-employed, and it is always a bit of a worry when you're away and you're not at the practice because you've still got bills to pay, still got staff to pay. But actually with Denplan, it does take some of that worry away because you have got that constant income coming in and that constant sort of support really. So that really helps with our work-life balance as well.
So how are you using new technology to enhance the way that you care for your patients?
I'm a big believer that technology has already and will continue to improve dentistry for dentists and for our patients. And I think that as a practice owner, the more you can invest in new technology, the more you're actually going to enjoy your dentistry, the more predictable it's going to be, the more effectively you're going to be able to communicate the treatments that you're providing with your patients. And at the end of the day, the better service and outcomes the patients are going to get from you. And I think we've invested a lot we've got, I think, 4-inch oral scanners in the practice now, in-house milling of our restorations. So the large majority of our restorations are all made in-house. 3D printers for smile trial mock-ups, the airflow units for our hygiene team. All of these little bits just show to our patients a different way of doing dentistry than they're used to. And it's wonderful to see them actually engaging. Dentistry has such a bad PR. The general population as a whole don't enjoy coming to see us. So we need to work on that as a profession. And technology is now allowing us to do that. One of the main pain points for patients is gooey molds of their teeth, naturally, because it's a really unpleasant thing to have done. But we can now completely get away from that. And our intraoral scanners have been a wonderful part of that. And I know Megs has been working with the team to get them trained up to scan as well. And that gives them more roles and brings them more a part of the whole process, which is really great, isn't it?
Yeah, it gives them more of an ownership and responsibility of the patients as well. It's not just our patients, they're everyone's patients of the practice, which is great. And just things, which we weren't really doing amazingly before, just monitoring tooth wear and things like that. Yes, you can take impressions and models and things like that, but models chip and break and you lose them and things like that. So storage is an issue, and disposing them again is an issue, and environmental factors and things like that. So actually being able to scan patients in using the intraoral cameras that we've got, storing those digital models on our records, and then actually being able to compare them over the next few years. And we can actually properly monitor them by millimeters, how much tooth wear has actually happened. So that's been it's been a massive breakthrough really in our sort of monitoring patients and their oral health.
What advice would you give to young dentists who sort of want to get into digital dentistry?
As a young dentist, you're not going to be able to make the capital investment to start with. So it's about getting into the right practices where there is a forward-thinking principal there who understands the value of it. So I think getting into that sort of practice comes down to your CV and comes down to your attitude. So my advice would be just to focus on your own training, focus on the postgraduate training, focus on bringing elements into your own day-to-day practice as an associate that improve the care you provide. So using magnification, using an intraoral camera. These things should all be a standard for young dentists. And that's going to show the forward-thinking principal who would have this sort of technology in the practice that you're the right sort of candidate for his clinic. And I think sorry, for hers. I mean, and certainly we found that with our associates. We've got a fantastic team of associates here now. They've all fully embraced the technology that we've had, and they're learning at a fantastic rate. So it's really great to be able to provide that for our younger associates, because I know from my own experience, it's just such a more enjoyable way of doing dentistry.
It's a learning tool as well, isn't it? You know, evaluating, you know, your margins and evaluating things on a camera where it's been blown up and magnified. Yes,
for sure. The speed of learning with digital dentistry is actually far better. And the really key thing for them to understand, and they'll learn this very quickly, is having an intraoral scanner doesn't make you a better dentist. You have to put the good preps in and the good scans in the same way that you do with analog dentistry, but you can see your mistakes much quicker. And so I think, the learning curve is much faster, which will hopefully be for the benefit of the whole dental population in the UK and therefore for the patients.
What advice would you give to other dentists who would like to go private with Denplan?
So I think change is always a scary thing, and making a leap of faith towards something is always going to be worrying. So speak to other dentists who have done it, see what their feelings are about it. But certainly for us, I think we found working with Denplan on the transition process to be very, very supportive, very helpful. We were going into uncharted territories from our point of view, and having a partner who had done that many, many times before gave us that security that the transition would be successful, and it definitely was.
Simon and Meghan, thank you so much for taking time to chat today.
Thank you, it's been our pleasure.
Thanks again to our very own Lewis Mackenzie for hosting, and for Simon and Meghan for taking time out of their busy schedule to talk to us. Don't forget to subscribe to ensure that every episode of the Dental Podcast is delivered to your feed on release day. If you'd like to hear more from us, be sure to follow us at Denplan on Facebook, Instagram, Twitter and LinkedIn. Thanks again for listening.